Good afternoon and welcome. This is the MSc Cardiovascular and Respiratory Healthcare Open Event. Today you will be hearing from our course director, Professor Daryl Francis, and Senior Teaching Fellow, Dr. Leanne Felkin. Just a few things to note before we start. You can post any questions in the chat, and this event, just as a reminder, this event is being recorded and will be circulated to you after. Thank you.
Brilliant. Thank you very much. So welcome to the course. My name is Daryl Francis, and I'm delighted to talk to you about this course. Many of you will be following this on a video later. So it is unique in that it covers both cardiovascular and respiratory healthcare in a single MSc. So next slide. Yeah, a few more people slipping in. So Leanne, can you advance the slide? Oh, maybe you have, and maybe what has happened is I've become disconnected. Right, okay, when I did my personal advancing, it disconnected me from you. Okay, now I understand. So today we'll discuss what the program entails and describe what you'll learn. And in particular, we'll talk about your research project, which is a major part of this course, as it is a research MSc. We'll then look at what became of people who have been in the course on previous years, and then details on exactly how you should apply for the course, and then time for questions and answers. Thanks. So the course, the key staff of the course are myself. As you can see how young and youthful I am. On Teams, actually, the video makes me look much older, but that's actually me. The photo of me is there. And we have also Dr. Leanne Felkin, who's our Senior Teaching Fellow, and Ryan Kelly, who's our Administrator. We are based at 3 campuses. The National Heart and Lung Institute has one campus at the Royal Brompton Hospital, which has a long history in discovery science and clinical research in heart and lung disease, and has one of the world's largest lung hospitals and heart hospitals on site. We also have a part of the work and research at Hammersmith campus of Imperial College, and other parts at South Kensington. Our university has many departments, but the National Heart and Lung Institute has over 500 staff, many fellows of major academic societies, and holds hundreds of millions in research grants, which are obtained through peer-reviewed competitive applications. As you know, it's a very world-leading institution, and this is one of the bases of this. We are the largest institute in the world for teaching heart and lung science, and we have over 200 PhD students and 150 MSc students at the moment. So our students come from a wide range of disciplines, and they progress into a wide range of next steps. So graduates, people who come to us might be recent graduates of medical biosciences, sports and exercise science, rehab, nutrition, pharmacology, but also people who are working in healthcare already some time after graduation, such as nurses and doctors, physiotherapists, respiratory therapists, and also allied health professionals. All are welcome. Imperial is in the top handful of societies. Oh, we're in the rank number 2 now in the QS World University Rankings. But most importantly, we are the only program, we are the world's top program that combines cardiovascular and respiratory science in a single syllabus, in a single MSc. And it focuses on clinical application of knowledge, learning how to critically evaluate the latest research, and formulate evidence-based practice. We combine innovation and technology to improve healthcare. That's the purpose of Imperial College London. And we learn real-world skills that are going to enhance your career and be transferable. That's our aim from within the MSc. And to do this, you'll conduct your research projects in world-class facilities, supervised by our experts, many of whom are international leading experts in their fields. So I'll now turn on to Dr. Leanne Felkin, who will tell you more about the programme.
Okay, thank you very much, Daryl. So good afternoon, everyone, and I'm going to spend the next 10 to 15 minutes giving you an overview of the programme. I'm going to tell you a little bit about how we teach and assess here at Imperial, and I'll also talk about your research project. And then when you're really excited about the programme and the curriculum that we have to offer, I'm going to outline our entry requirements and explain how you can make an application to come and join us. So the Cardiovascular and Respiratory Healthcare Programme was established in 2018 and is now in its 8th year. The programme is designed to be flexible, and it can be taken as the full MSc, as a PG diploma or a PG certificate. And each year we have 25 spaces available. We teach face-to-face on campus, and we're based primarily at the Royal Brompton campus next to the Heart and Lung hospitals that Daryl told you about earlier. But we also visit the Hammersmith campus and the main campus, Imperial's main campus, up at South Kensington. The programme lasts for one full calendar year of 52 weeks. And for the academic year 2026, this will start on the 26th of September. The structure of the programme is modular, with both taught modules and research modules. It can be completed in 3 different ways: in the PG Cert, the PG Diploma and the full MSc. And the different awards reflect the number of academic credits that our students complete. All 3 programmes undertake the taught modules, with the full MSc also requiring students to complete the research project. Our taught modules are split into core modules and the elective modules. The core modules are compulsory. We offer 4 core modules, and these form the foundation of your learning on the programme. We also offer 4 elective modules, and these allow our students to personalise their programme. And here you choose 3 from a choice of 4. And students typically choose the elective modules according to their interests, but they also make choices based upon the skills that they wish to develop and the learning experiences that they want to have with us here at Imperial. Our 4 core modules, as I said, form the foundations of the programme, and they reflect our scientific and our clinical approach. The modules of Foundations in Cardiovascular and Respiratory Sciences and Study Design have a more academic and scientific approach, whereas the modules Reflections and Evaluation of Clinical Practice and Quality in Cardiovascular and Respiratory Healthcare are more clinically focused. And this slide summarises the key information about these modules, including the number of teaching days and the assessment type. And I'll just take you through these modules one by one. Foundations is a double credit module, and this year our module lead was Dr. Rashida Chowdhury, who was an electrophysiologist here at NHLI. The module covers cardiovascular and respiratory anatomy and physiology. There are 19 days of teaching, and there are 2 assessments, a written assessment and an oral assessment. Study design is led by Dr. Andre Amaral. Andre is an epidemiologist here at the National Heart and Lung Institute, and in this module you will learn the principles and practice of quantitative and qualitative research. These skills are necessary for you to be able to critically engage with the literature and also help you develop your own research project at the end. There are 8 days of teaching, and the assessment for this module is an oral presentation. Reflections and Evaluation of Clinical Practice is led by Professor Elizabeth Renzoni, who is a respiratory consultant practicing at Royal Brompton. This module teaches our students to critique clinical practice in relation to the evidence-based guidelines and to reflect systematically on how to improve practice and the delivery of healthcare. There are 3 days of teaching in this module, but importantly, our students attend 4 clinics from across our partner hospitals to observe how cardiovascular and respiratory healthcare is delivered by the NHS. The assessment for that is a written assessment. Lastly, we have Quality in Cardiovascular and Respiratory Healthcare. This is led by Dr. Peter George, who is also a respiratory consultant practicing at the Royal Brompton Hospital. And in this module, our students are taught to critically consider the factors which contribute to the delivery of high quality healthcare. There are 5 days of teaching for that module, and the assessment is an oral presentation. Moving on to the elective modules, we offer 4 elective modules from which our students choose 3. 2 of the modules relate to cardiovascular healthcare and 2 relate to respiratory healthcare. Our cardiovascular modules are the Innovations in the Management of Cardiovascular Disease, which is led by Professor Stuart Rosen, who is a cardiologist practicing at the Royal Brompton Hospital. There are 5 days of on-campus teaching and the assessment is an oral assessment. Cardiovascular Health, Prevention and Rehabilitation is the second of our cardiovascular modules. The module lead is Dr. Kajaluxi Anafan. She's a doctor working at our Hammersmith Hospital. The teaching has 4 days of on-campus teaching and 2 days of remote teaching. And again, the assessment is an oral presentation. Moving on to our respiratory modules. The first module is Pulmonary Rehabilitation and Community Respiratory Care. That's led by Professor Nick Hopkinson. Nick is a respiratory consultant in the Royal Brompton Hospital. He's also the medical director of Asthma and Lung UK. That module has 7 days of on-campus teaching and also the opportunity to visit an advanced COPD clinic and a pulmonary rehabilitation session. The assessment for that is an oral presentation. And our last elective module is Respiratory Failure and Respiratory Support. The module lead is Dr. Lydia Finney, who is another of our respiratory consultants here at the Royal Brompton. There is 4 days of on-campus teaching, and the assessment for that is a practical assessment. So having introduced you to the taught modules, in my next slide, I'm going to show you how these fit together across the academic year. So this slide summarises the MSc journey for a full-time student. The timeline shows how the different modules are taught across the academic year. So our academic year starts in October with the core modules, Foundation and Study Design. There is a 2-week break over Christmas for our winter break, and when we return in January, students undertake their elective modules. And the exact timetables for the elective modules is different for each of the modules. They also begin the core module Reflective Practice and start their clinic visits for that module. There is another 2-week break, for the spring break, and then we return for the summer term. And here the quality module is taught. Students begin their research projects, and they may also be finishing up their clinic visits for the reflective practice module. For myself and Darryl and the rest of your module leads, the exam boards that we hold are held in July and September. So looking ahead, should you wish to come and join us here at the National Heart and Lung Institute, here are some key dates. Imperial will host its induction week or its welcome week in the week beginning the 28th of September, and teaching will start on the Foundations module on Monday the 5th of October. The final assessment for the research project will be in September 2027, and degrees will be awarded on the 1st of November 2027. And then finally, our graduation ceremony will take place around late May or early June 2028. And we celebrate our graduates in the truly remarkable setting of the Royal Albert Hall, which is just behind Imperial's main campus in South Kensington and overlooks Hyde Park. An important question that we're frequently asked is, how will I learn on the programme and how will I be assessed? Our teaching is very student-centred, and we have a multi-mode delivery, which means we teach you using a range of different formats. What it means in practice is that we put our students at the heart of what we do in the classroom. And we've been able to learn and keep from best practices over the years to deliver your teaching in a range of different formats. So we teach using the traditional lectures and seminars, but we also have hands-on workshops, problem-based learning, journal clubs, clinical case studies, guided online learning and video tutorials. We also use a wide range of experiential learning, which is a highlight of the programme, and I'll expand upon that in my next slide. Our teaching is delivered by clinical and research specialists in the fields, and you'll be supported throughout the programme and by myself as the dedicated senior teaching fellow on the MSc. Finally, we will assess your learning using a range of authentic formats to showcase the knowledge and skills that you've gained with us. These include scientific report writing, oral presentations, poster presentations, case study analysis, and journal clubs. And we describe these as authentic assessments because they are purposefully designed to replicate professional activities undertaken in the workplace. So this means that our assessment strategy will allow you to develop and showcase and practice the skills you will actually go on to use in your work in life. Our experiential learning techniques are a unique part of our MSc, which sets us apart from many of the other postgraduate programmes out there. Experiential learning means to learn through your experience. It consolidates your knowledge and understanding, and crucially shows you how to apply your knowledge and your understanding. And to do this, we make the most of the remarkable facilities we have here in the Faculty of Medicine and at our partner hospitals to create learning experiences for you, which quite simply you cannot access anywhere else in the world. And our students frequently cite these experiences as highlights of the MSc programme for them. So during the programme, we will visit the Human Anatomy Unit at Charing Cross Hospital. Here, our students visit the Pathology Museum and the Human Dissection Rooms, where Imperial's anatomists use prosections to show you actual anatomy and how this differs from what you will see in the textbook. And this allows you to experience and learn about cardiovascular and respiratory anatomy hands-on. You will visit the cardiac catheterization labs at Hammersmith Hospital to observe our cardiologists and our cardiac physiologists at work. In Imperial's newly refurbished teaching laboratories in South Kensington, you will design and conduct exercise physiology experiments for your foundations module. And lastly, we're especially pleased to be able to take our students to a scientific conference. In November, as part of the Foundations module, we visit the winter meeting of the British Thoracic Society, of the BTS. The BTS is the UK's premier society of leading respiratory healthcare professionals and scientists, and it's an opportunity for our students to hear the latest research firsthand, and of course to network and build those connections which are important for your future careers. It's also an opportunity for our students to get a glimpse of their future. Each year, research carried out by our students during their research project is presented at the BTS conference. And this year, one of our students from last year's cohort will be there presenting her research project findings. So moving on now from the taught element of the programme to the research project. The research project is the capstone of your MSc. It's where you're going to apply and develop all of the skills and knowledge that you've gained during the taught modules. Our projects at Imperial are supervised by our academics and our professors here at the National Heart and Lung Institute. And during your project, you will become embedded within their research team, and you will take part in and contribute to the cutting edge research that we carry out here at the NHLI. You'll be making the step up to work alongside the academics and researchers whose work you have been learning about in the taught modules. We offer a range of different project types from both the cardiovascular and the respiratory field. They include clinical research, where you'll be collecting data from patients or healthy volunteers in the clinic, laboratory research, where you can carry out experiments in our world-class facilities. Some students choose to do data analysis projects or systematic reviews of the literature. These can offer some flexibility. And students who are interested in improving healthcare, we offer service evaluation and quality improvement projects. And lastly, our students have the opportunity to develop their own projects alongside an Imperial academic. I'm going to move on now to talk about what happened next to our graduates after we celebrated with them in the Royal Albert Hall. So an MSc, whether you take it here or anywhere else, is a stepping stone. And it's a stepping stone which opens up many different and exciting opportunities for you. We now have over 120 graduates from our MSc, and being a healthcare MSc, it'll be no surprise to hear that many of our graduates pursue clinical careers or careers in healthcare. Each year, a number of our graduates go on to study medicine, either undergraduate level or graduate entry-level medicine. We've had one who's gone on to study dentistry. Some graduates have joined the NHS Scientist in Training programme, which is extremely competitive, and they are now working as a cardiac physiologist in the NHS. Others have NHS roles working as respiratory physiologists. They've gone on to train as physician associates. One of them is in training to become an echocardiographer, and they are managing clinical projects in the NHS as well, such as medical imaging. For students who are already working in healthcare, many of them have used their qualification to gain promotion. So, for example, our nurses have gone on to be promoted to clinical nurse specialist, or they have become research nurses or moved out of the NHS into the charity sector. Others are working in UK government healthcare posts, imagining and helping delivering change in healthcare in the UK. They're also working in digital health. Many of our students go on to further study at PhD level. Currently, we have at least 7 students who are undertaking their PhD at Imperial. We have students who go on elsewhere to Cambridge and Glasgow and overseas universities. In addition, they have embarked on careers in education as university lecturers, both here in the UK and overseas. And lastly, many of our students move into industry, working as project managers, business analysts in healthcare industries, healthcare researchers, medical writing, and also working on medical imaging and AI projects. So I'm finally on to my last few slides, and I hope that what you've seen today has really tempted you into applying to come into to study our MSc here with us at Imperial College. So what follows now is some key information for you and the next steps. The entry requirements for the programme are an upper second class BSc, which is a 2-1 or equivalent in a medical, biomedical or healthcare subject. If you speak English as an additional language, you need to demonstrate your competency in English by meeting Imperial's higher English language requirements. You must also submit a personal statement demonstrating that the course is the right course for you, and explaining your motivation for the course and showing that you have the skills, knowledge and the aptitude to achieve the course requirements. And lastly, your application must be supported by 2 references. Applicants who meet the first 3 requirements are guaranteed an interview. If you are currently an undergraduate student and don't know what your results are yet, your results are pending, any offers that are made following interview will be conditional on the outcome of your programme. And if you do not meet the programme requirements, but you have sufficient relevant professional experience, there's a route for you via the special case procedure. This is where your application will be assessed on its merits, and in such cases your personal statement can be pivotal. Lastly, we do not accept intercalating MBBS students, and this is simply because the academic year timings don't match. In terms of the actual process for applying, applications for 2026-27 are now open. Applications must be online, and you will need to register with My Imperial to make an application. You can submit 1 application per year of entry, and you can choose up to 2 courses per application. There is an application fee, but we do have fee waivers for those who meet the criteria, so please do email us on the MSc email for information about this. We review our applications weekly, and we hold online interviews twice a month. Outcomes are communicated within 5 working days, and if you're successful, we want to make you an offer. The university will make you an offer and will outline any conditions that you're required to meet. The deadline for home applications is the 1st of August, and the deadline for overseas applications is the 30th of June. And we close our overseas applications earlier to allow time for the extra visa paperwork to be completed. We do strongly suggest that you apply early, as we do operate a waiting list once we fill up. In terms of funding your studies, Imperial offers a range of internal scholarships. You can search for these on the Imperial website using their online scholarship search tool. You will need to filter the scholarships by selecting for the postgraduate taught courses and the National Heart and Lung Institute. Please do check the application deadlines for scholarships and also the eligibility criteria. And you can also use the search tool to look for external scholarships as well. So this is my final slide. If you have not joined the mailing list, please do so. The link is below. I'm sure it will also be dropped into the chat. When you're on our mailing list, this will allow us to keep you updated with the latest news and also key dates. So thank you for listening, and we have time now to answer any questions.